Hi everyone, this is going to be a teaching style video for axial skeleton functional grouping. We're going to be taking a look at common actions and common nerves for the muscles that act in the thoracoabdominal region for trunk functions and breathing, as well as our pelvic floor muscles. Before we get started, the concept of a unilateral versus a bilateral movement or contraction. There are pairs of these muscles lying on either side of the body, and a unilateral contraction will cause a one-sided movement of the body or a unilateral movement, and then a contraction of both sides of these muscles, so both sides of the body. A bilateral contraction will cause a movement that involves the whole body. The fiber orientation of a muscle cues us into the motions available for that muscle, so take a look at that. And then the motions that are available by plane. In the frontal and the coronal plane, we have lateral flexion. In the sagittal plane, we have flexion and extension. And then the transverse plane, we have rotation. Taking a look at the action of trunk flexion, the muscles that work to do this action are our internal abdominal oblique, our external abdominal oblique, and then our rectus abdominis muscle here. These three muscles are all innervated by the thoracoabdominal nerve and work to bilaterally contract to cause trunk flexion. Next, our internal abdominal oblique and our external abdominal oblique both work to unilaterally cause trunk rotation in the transverse plane and then trunk lateral flexion in the coronal or the frontal plane. These muscles are innervated by the thoracoabdominal nerve. Next, taking a look at adding in our transversus abdominis here, number 4. When all 4 of these muscles bilaterally contract, they work to compress the abdominal viscera, and they're all innervated by the thoracoabdominal nerve. Next, taking a look at some respiration muscles. We have first here our respiratory diaphragm or a diaphragm. This muscle is innervated by the phrenic nerve. And when the diaphragm contracts, it allows for the rib cage to become longer and allows for the lungs to fill with air. So it works to help allow for inspiration to occur, or our action of breathing in. And like I said, the diaphragm is innervated by the phrenic nerve. Next, taking a look at inspiration again. These two muscles are our external intercostal, seen here number 1, and then our serratus posterior superior. These muscles also work to elevate the ribs during inspiration, which allows for your lungs to expand and allow for air to come in. However, these muscles are innervated by the intercostal nerve. So the diaphragm, as well as external intercostals and serratus posterior superior, all work to do inspiration, but these two muscles are innervated by the intercostal nerve, and like I said before, the diaphragm is innervated by the phrenic nerve. So same action, different innervation. All right, next we have forced expiration. During passive expiration, which is not forced, it would be no muscle contraction, as expiration normally is just a passive movement that doesn't require any muscle contraction. But forced expiration, like if you were to go to blow out a candle, that causes or requires muscle contraction. So the 3 muscles that do this are the internal intercostals, seen here in between the ribs. We have serratus posterior inferior, and then we have the transversus thoracis, which we call our jazz hands muscle on the back of the chest plate. These 3 muscles are also innervated by the intercostal nerve, but they work to do forced expiration. All right, lastly, we have our pelvic floor muscles. They work to support our pelvic viscera. 1 through 3 are levator ani muscles working to support the pelvic viscera. The common innervation for all these muscles is the sacral plexus. Number 1 here is our puborectalis muscle. Number 2 is our pubococcygeus muscle. Number 3 is our iliococcygeus, those 3 muscles being our levator ani muscle group. And then number 4 here is our coccygeus muscle, which is a part of the pelvic floor, but not a part of levator ani. Like I said before, all of these muscles are innervated by branches of the sacral plexus, and they work to support the pelvic viscera. I hope this was helpful. Thank you.